And so when we think about rheumatology, or when you see a rheumatologist, you see them because they're trained. They're trained to help you in terms of help managing diseases or symptoms related to muscles, bones, joints, tendons, and ligaments, soft tissues, connective tissues, right? And so what's interesting is that when you look at the root word of rheumatology, which is rheuma, what it's describing here, it doesn't say the study of bones, the study of joints, the study of muscles. No, it says it's the study of that which flows as a river or a stream. That which flows as a river or stream. You're thinking, well, why is that? It's because a picture of health is a picture of someone moving and flowing without anything impeding them, without any restriction, without any stiffness, without any pain. And that's really the goal of the rheumatologist, is to have their patient be able to move freely, have them flow, as it were, because many of the patients are coming in because their body isn't flowing optimally, right? And I wanted to capture this concept of flow because it overlaps with Chinese medicine. In Chinese medicine, we look at health and disease. Health is a proper balance and flow of energy that we refer to as qi. Now, without having to define qi, without having to go into explaining what qi is, it's just a concept of energy. The idea that the body, when it's not flowing well, symptoms and disease can set in. And the disease, the precursor to disease or symptoms, is usually a blockage or stagnation of this qi, or a deficiency or a lack of this qi. For the purposes of this talk, when it comes to things like stiffness, joint pain, and even inflammation, I intend to focus on qi stagnation or qi blockage. And so you may be asking, well, what is qi stagnation? That sounds kind of weird. Never heard of that before. Well, a good way of thinking it, I mean, really, even in a textbook, they would describe qi stagnation as stress. Stress, okay? Now, just like stress from a Western perspective is hard to describe, hard to define, qi stagnation, in a similar way, may seem like it's hard to define, but we know it, we recognize it when we see it, and we live it to a certain degree every day. Qi stagnation, the idea here is different forms of stress. Different forms of stress. Stress that specifically I wanted to mention, again, is cumulative. It's chronic, it's repetitive, all right? And so you can think of, well, there's different forms of stress. There's physical stressors. You can think of infection. You can think of pregnancy. You can think of surgery. Those are examples of physical stressors. There's emotional stressors, like a history of an abuse or history of a loss of a loved one, or going through maybe like a divorce. Or social stressors like financial, job-related things, giving care to an elderly parent. How do you find childcare for your school-age child when there's COVID? I mean, there's social stressors, and there's mechanical stressors like, again, car accidents, maybe a sports injury. We see a lot of patients who are perhaps long-distance runners, for example, and they may come in with chronic pain. Okay, so there's different forms of stress. Again, it's cumulative. And this idea that chronic stress, cumulative stress over time generates this concept of what we call heat in the body, okay? So I use this analogy often with my patients who are coming in for an inflammatory condition. The body is like a car engine. It gets overstressed, it gets overworked, it gets overheated. And this idea is that heat accumulates in the body daily. We all generate a certain amount of heat every day. And so what does heat do in the body? Well, it tends to rise and it tends to expand. So if you think of a wildfire, so we're familiar with this in California, being in Los Angeles, and perhaps you see this on the news, but it spreads quickly, expands outward. And then you think about steam, you know, how it just rises out. Much like if a car overheated, you lifted the hood and you just see the steam rise. So the heat tends to rise and it tends to expand, and that's what also happens in the body. And what I mean by that is heat symptoms can manifest as things as rising symptoms. And so that could be, if you can imagine, like heartburn, and that could be sore throats. It could be chronic neck pain. It could be ringing in the ears. It could be unsteady sensation, maybe some vertigo. It could be breakouts. It could be facial flushing. It could be headaches. It could be insomnia. It could be high blood pressure. Those are all kind of like rising symptoms that could be a part of a heat pattern. What also can be a part of a heat pattern are these expansive symptoms where people can experience joint pains arthralgias in their hands, maybe in their feet, or some breakouts, itching, some hives on their arms and their legs, and breaking through their skin. Those are some examples, perhaps, of a heat pattern. So this idea is that the body generates heat, and likewise, the body has to clear heat. If it doesn't clear heat on a regular basis, then the body's going to find another way to get rid of this heat. And that's when it usually manifests as signs or symptoms of inflammation. Okay, so how do we generate heat? Or in what ways do we generate heat? Well, I already touched upon stress. That's probably number one for most people that we see, but probably a close number two, and perhaps it is a number one, is diet. Diet, it's what we put into our body can add more heat to this heat pattern. At the same time, it could be dietary preparation, not just the food itself, but how it's prepared. It could be smoking tobacco. So something that needs to be addressed, those who are smokers are at more risk for inflammatory conditions. It can also be a lack of sleep. And so this is part of our intake. We always try to assess patients' quality of sleep. Those who don't sleep well or sleep enough are more prone to inflammation. And this has actually been demonstrated in a study done at UCLA, where we took normal people, and they happen to be medical students, and we called medical students normal, and they didn't sleep the night before. And they took a blood test prior to going to, sleep, and after, when they wake up, or in the morning after they haven't gotten any sleep. And they found that the tests show that the inflammatory markers were already elevated in the morning after one night of sleep deprivation. Now, it's not clinically significant where it would turn red on an abnormal blood test result, but you already see there's an elevation there. And so you can just imagine chronic sleep loss, chronic sleep deprivation, what that's going to do to our inflammatory markers. So a lack of sleep, it's like the engine in the car never being turned off. It's like you park your car in the garage and you leave it on overnight and you come back the next morning. You can imagine that it's going to overheat. It's likely going to break down. Then there's emotions. And I want to highlight this specifically in terms of emotional stress, but emotions that are unprocessed or internalized. It's the idea like you describe someone as so angry that their blood is boiling. It's this idea of heat brewing within the body, or you're anxious, your body's getting revved up, or you have resentment, or you're harboring frustration, bitterness. Those specifically are recognized in the Chinese medicine textbooks as generating more heat compared to other emotions. And then there's medications. Certain medications themselves, whether it's steroids, cumulatively can lead to heat generated. Chemotherapy can do that, and also radiation therapy as well. So certainly whenever we can reduce these, we want to be able to do that. Then if we talk about how you generate heat, heat in, how do you get the heat out? So what does the body do when the body is hot? When the body's overheating, what we tend to notice is that the body sweats. The body sweats, right? And this is actually what I want to highlight in terms of exercise, because when it comes to exercise, many patients can't reach a certain maximal predicted heart rate. They can't get their heart to 140 beats a minute per se. But the therapeutic value of aerobic exercise from a Chinese medicine perspective for patients with a heat pattern is just with the goal of them breaking a sweat. When you break a sweat, you clear heat. Another way for a woman to clear heat is actually through her menses. And so this is something that you may want to pay attention to, is because if your symptoms are worse prior to menses, and they tend to get better after the onset of menses, this may be an indication of a heat symptom or a heat pattern. Okay, the body gets rid of heat through the bleeding. And so you can think of it from a woman who's menopausal, right? When their mechanism of having a regular period is no longer there. What happens? Well, classic symptoms of a woman in menopause would be hot flashes, would be night sweats, being irritable, maybe some dryness symptoms, insomnia. So those are all common heat symptoms, and that's because the body doesn't have this mechanism to clear the heat. The other way the body clears heat is actually through urination. So hydrating enough, adding enough coolant to your engine so that your body remains cool. And how much is enough? Well, I usually say drink enough fluids, enough water so that your urine's clear, right? That's how we'll know we're drinking enough fluids. The other way the body gets rid of heat is through bowel movements. And the important thing here is regular bowel movements. A sign of a heat pattern for many can be constipation. The other thing is actually could be what we call dysentery or bleeding in the stools. Okay, so that could also be an indication of heat as well. And it could be the body's way of trying to get rid of heat. But obviously, if it's excessive bleeding, if it's a lot of bleeding, we have to go in there and stop the bleeding, figure out the cause, and get it to stop. I think of this as the exhaust on the engine. It's the idea that without regular elimination, you can imagine like a car with no exhaust pipe, right, or being plugged up is just going to cause the engine to blow up. And that's what's going to happen if we have no regular elimination as well. The other way in which the body can clear heat is actually through crying. And those who don't cry, even though they have the urge to cry, often can experience red eyes or bloodshot eyes or irritated eyes as well. But crying is a way to clear that heat through the eyes. Adequate sleep, as I kind of touched upon, sleep deprivation can lead to inflammation. So getting adequate sleep obviously is important as well. What I want to highlight with this slide here is that the body has to get rid of heat in some way, either it's through sweating, or it's through bleeding, or it's through urination, or through defecation, or through secretions like crying. The body, in order to get rid of heat, has to actually literally get rid of something. And that's what some herbs in Chinese medicine can help do, and what some nutritional things that we'll talk about can help do as well. So generating heat, clearing heat, and then there's reducing heat, which just means stress reduction, stress management, having regular outlets, whether that's deep breathing the heat out in a sense, prayer, meditation, journaling. It's a way to express some of these internalized, maybe repressed emotions that can trouble one not get enough sleep. Maybe journaling or expressing and talking about it, dancing or painting is a way to release some of that excess energy and heat. Other way to reduce heat is through diet, minimizing warming foods, increasing cooling foods. We'll talk about that in a little bit, and then the anti-inflammatory diet. So hopefully I didn't lose any of you here. We're going to now transition to this idea of diet, right, and how we can help patients with heat patterns, including inflammation, arthritis. So let me just start by saying that Chinese nutrition, there's a quote by Hippocrates saying, "Let food be thy medicine and medicine be thy food." Okay? Let food be thy medicine and medicine be thy food. This is why food is so important. And something we talk about with majority, if not all of our patients. Chinese nutrition or dietary recommendations is consistent with traditional Chinese medicine principles. It's really an extension of herbal medicine. But herbal medicine, there is some concern because there hasn't been a lot of studies done with herbs and perhaps medications. So there's potential herb-drug interactions. Herbs are much more stronger, so they have potential for adverse effects and potential toxicities because, like medicines, herbs have to be processed by your liver and your kidneys and metabolized and eliminated. But you can still get a lot of the benefits of herbs through diet. And so Chinese nutrition is something I tend to emphasize with our patients. It's an energetic form of therapy. What I mean by that is that it can be warming, it can be cooling. Again, we'll touch upon that as an example. It's practical, something we all do every day, multiple times a day. It's safe and is relatively inexpensive, especially if you're considering this relative to medications and the other things that we do for our patients. Chinese nutrition, all food substances have therapeutic properties. And what I want us to move away from is this idea that food is not inconsequential. What I mean by that is that food, anything you put into your body will have an effect, whether it's a helpful effect or it's a harmful effect. But it's not what we call inert, meaning it's not just going to do nothing. It's going to do something. All right. So when the phrase is used, "you are what you eat," in many ways that's true. So we have to think about what are we putting into our bodies? And from a Chinese nutritional perspective, we have to customize the diet to an individual's environment, their constitution, and their condition. And that just means that you cannot have a one-size-fits-all. It's not one diet book that's going to be given to 200 people in an audience and say, you all follow this diet. Chinese medicine, fundamentally, it doesn't work that way. It's customized to an individual, again, to their pattern, to their constitution, to the presenting symptoms, and to the environment. And what that means is certain foods are in season at certain times of the year. Certain times of the year have certain weather conditions, environmental changes that can affect one's symptoms. So you have to adjust the diet according to that. And so we'll talk about that in a little more detail. And it has Chinese nutrition, we have to avoid overindulgence in one particular type of food. We have to maintain balance. Again, this is important. And balance is not just certain food groups, but it's also tastes. So in Chinese medicine, we recognize taste. There's 5 specific tastes that we're going to talk about. Before I do that, I just want to mention balanced diet with a large variety of fresh organic foods will supply most essential vitamins, minerals, and antioxidants. And if you have a balanced diet that includes these food groups, you really don't need supplements. All right. So some of you may be wondering, well, what supplements can I take, or how many supplements should I take, or what health supplements are good? Supplements are helpful in a specific when I have a specific indication, perhaps for a short period of time, perhaps for a long period of time if that indication persists. But for many patients, if you have a balanced diet, you'll get the majority of your essential vitamins, minerals, and antioxidants. So those 5 flavors I mentioned, these are the 5 flavors. So we have pungent, sweet, sour, bitter, and salty. And so some of you may be wondering, what's pungent? You can think of it as spicy. You think of spicy, it's often used as that sort of in reference to that. So I highlighted pungent and I highlighted bitter because from a heat pattern perspective, those who have a heat pattern should be careful about spicy foods, which are energetically more warming foods. You want to be limiting the amount of spicy foods that you eat. And you want to actually have more bitter foods. Bitter foods in Chinese medicine, the taste of bitter actually clears heat. For those of you who ever tried Chinese herbs, you probably recognize that a lot of herbs tend to be bitter. But Chinese herbs is not unique to that alone. Like if you think about Western medicines, a lot of them are bitter too. If you think about penicillin, if you ever tasted it's bitter. Maybe you think about Tylenol, if you ever tasted it, it's bitter. So a lot of these are clearing heat medications as well. But you probably recognize that if you were to ask patients in general, go find something that's bitter and eat it. You may have a hard time figuring out, well, what is bitter? I mean, we were so not used to getting bitter foods. We probably have a hard time finding bitter foods because we don't think of that. And a lot of our choices for our diet is based upon taste. Okay. So, well, we'll talk, what are some examples of bitter foods? We'll get into that in a little bit. Okay. So we have a lot to cover here. So what are warming and hot foods? And when I say by warming and hot foods, it's not temperature, it's energy. Okay. Energetically warming and hot foods. So things like alcohol, caffeine, chocolate, red meats, nuts. All right. So some people think about those who drink alcohol, their face may turn red. Right. That's an indication of heat rising. All right. Or things about caffeine. Caffeine is like the analogy of the car engine is getting the RPMs to go up, right? And you can generate more heat because caffeine's a stimulant. Not only is caffeine a stimulant, it's a diuretic. It makes you urinate more. So as you lose that coolant to the engine, you can more prone to dehydration and overheating. Chocolate, red meats, and nuts. So if you think about this list, you may have seen this list or heard this list before, because this is very common for patients with reflux, GERD, or heartburn. They're often told to avoid these foods. And the commonality among these foods is that they're all warming foods. They're all hot foods in a sense, and that can make heartburn worse. So there's a commonality there because heartburn and GERD is often a heat pattern. Other examples of warming and hot foods would be things, certain vegetables. Certain warming vegetables would be like parsnips, parsley, winter squash, sweet potatoes, onions, chives, garlic, leeks, and scallions. These are all examples of warming vegetables. There's also warming spices. Now, I want to mention that spices is not the same thing as spicy. Spices are not the same as spicy because there are some cooling spices as well. But the warming spices are things like ginger, cinnamon, cloves, rosemary, turmeric, and peppers. And then the last thing on this slide is that the food preparation can also add warmth or heat to the food as well. We think about specifically barbecue foods, curried foods, deep fried foods. Those add more heat. Grilled foods, more heat to the food before it's introduced to the body. So with this slide, some of you may be wondering, well, we're talking about inflammation, we're talking about arthritis, and I see here ginger and turmeric. And why am I hearing or reading or being told to take ginger and turmeric when I have arthritis, I have inflammation, and that's a heat pattern? And ginger and turmeric are warming foods or spices. And I just wanted to say that not all inflammation is the same. And so from a Chinese medicine perspective, there's actually different types of heat. And so what I mean by that is, in this situation, ginger and turmeric can be helpful for something called cold-induced heat. And you may be wondering, well, what's cold-induced heat? Cold-induced inflammation is basically inflammation that tends to get worse in a cold environment. So what I mean by that is, if you think about a patient with arthritis, whether it's like rheumatoid arthritis or osteoarthritis, you may notice that your symptoms get worse in the winter. Your symptoms get worse when it's cold. Your symptoms get worse when it's damp, or maybe when it's windy and the wind chill causes the temperature to drop. That's cold-induced heat. Those patients tend to benefit from warming spices like ginger and turmeric and peppers. Okay, but heat-induced heat, and there's some arthritides that are heat-induced heat are worse in the summertime or worse in a hot environment, maybe like lupus arthritis, for example, psoriatic arthritis for many patients. You would not want to recommend ginger or turmeric for those patients because it can often make things worse. Okay, so there's a subtlety there, but the important point I want to make is not all inflammation and not all arthritis is the same. So you can see here, ginger, just mentioned, it's a common spice. It's recommended. It has blood thinning properties, cholesterol lowering properties. It's been studied in patients with osteoarthritis of the knee. And those who receive ginger extract twice daily experienced less pain and required fewer pain medications compared to those who received a placebo. Again, this is osteoarthritis, which is often as a cold-induced heat pattern. And what I want to mention here with ginger is it has blood thinning, meaning it promotes circulation. You actually feel warmer when you drink ginger tea, for example. So the thing is here is that if you take a ginger capsule, like a ginger supplement, you have to be really careful. You got to tell patients you got to stop the ginger capsule at least a week before you go to surgery or something like that, because it has blood thinning properties. I even tell patients even drinking ginger tea, probably avoid it in the few days before as well. So they have to be aware of that when recommending it to patients. Turmeric, as well as I mentioned, it has an active ingredient called curcumin. It's contained in yellow curry powder. This has also been studied in an article submitted to Arthritis and Rheumatism and published in this journal of Arthritis and Rheumatism. They found that turmeric reduced joint inflammation. All right, so just going to move on to the next slide here. What are some cooling foods? Cooling foods. Well, so many of us think of fruits and vegetables. You'll notice I have here watermelon, honeydew, cantaloupe, and berries. And so the thing about these is that these tend to be in season in the summertime. In fact, you'll notice is that when you look at your grocery store ads, the things that are on sale during the summertime when the weather gets hot is watermelon, honeydew, cantaloupe, and berries, because this is what's in season. This is what's abundant. This is what thrives in a hot climate and a warm environment. These fruits are most intrinsically cooling. These fruits are the ones you want to have more of when you have a heat pattern, okay, because they're more effective in cooling the body down. So these fresh vegetables, similar cucumber, spinach, lettuce, and zucchini, these are cooling fruit vegetables, green vegetables in particular, as well. Legumes and grains, so soybeans, mung beans, millet, and barley. So I just would say that, barley, it's a watermelon, honeydew, cantaloupe, berries, often recommended for patients with menopause. There's a common heat pattern, a heat symptom. So this is something that could be tried. Barley is something that's tea. You can get this in the form of a tea, often served in Japanese restaurants. You can go to a Japanese supermarket or order online, but barley clears heat through actually promoting bowel movements. So those who have constipation, for example, would benefit from barley. The only caution with barley is that for those who are gluten sensitive or have a gluten allergy, the celiac disease, you have to avoid barley because it contains gluten, okay? Cooling foods, other examples, again, other cooling teas. I tend to recommend teas often to my patients because they're easy, they're portable, they're inexpensive, and they're therapeutic. So for a cooling tea example, like I would recommend mint. Now, mint is great for, it's an herb, it's a dietary herb. It's used for anxiety, it's used for stress, it's used to vent rashes, it's used for headaches. So mint is often something I drink when I just go to work. When they're seeing patients, I'm drinking mint tea in my office. Barley tea, again, as I mentioned, then there's flower teas. And so I have here a chrysanthemum. Chrysanthemum is a common, again, flower is a dietary herb. You can get in a Chinese restaurant and we eat dim sum, but it's in season in the summertime. It's a cooling tea. It's often used for headaches. It's often used for eye disease. So like for red eyes, dry eyes, irritated eyes, chrysanthemum is a great choice. It's also good for blood pressure. You can help lower blood pressure by drinking chrysanthemum tea. The chamomile tea, you think about that, it's easy to get, relaxing, calming tea, can help with relaxing your stomach muscles too, and help with digestion. Passion flower tea, a common recommendation for those who struggle with sleep, who have restlessness of their minds can't stop. Passion flower is a consideration. In fact, if you go to the supermarket and go to the tea section, oftentimes you will see like sleepy time tea, relaxing tea, soothing tea, and you look at the back of the box, you'll see it's often a combination of flowers. It's a different combination of flowers in there. So spices. So I mentioned earlier, there's warming spices, but there's also cooling spices. So some examples of that are dandelion, honeysuckle, cilantro. Honeysuckle is another flower. Honeysuckle is often good for fevers, just like chrysanthemum is also good for fevers too. So if you have a fever, if you have a sore throat, we think about chrysanthemum, we think about honeysuckle. Good choices. Bitter foods, as I touched upon earlier, what's an example of a bitter tasting food? Well, it's a little bit bitter. You think of it, and when you eat just celery, alfalfa sprouts, citrus peel, so orange peel, tangerine peels are actually edible. In classic Chinese cuisine, you actually cook with the peel instead of this orange sauce that's being used nowadays. You actually cook the beef and the chicken with the actual peel, and you can eat it. And then there's rye, and then there's actually something called bitter melon, which tastes very bitter. So it's appropriately named bitter melon. You can find this at an Asian supermarket. You can actually find this as a supplement form too. It comes in capsules, and that's a way in which you don't have to taste the bitter, I guess, but you can still get the effects in terms of clearing heat. Bitter melon actually clears heat through urination, promoting urination. So it's often given in Chinese medicine to people who have burning with urination, interstitial cystitis, that has a urinary tract infection. You can use bitter melon. It's often used also to like lower blood pressure. So, but studies in Western medicine are more looking at for blood sugar control and helping regulate your blood sugar, help with your diabetic control. So that's another consideration for bitter melon. We move on to the next slide. So I talked about warming foods, I talked about cooling foods. Now I just want to talk about this in a separate category called Yin Tonics. And you're probably thinking, well, I don't understand what Yin means. Well, what are Yin Tonics? And so Yin and Yang, right? Yin and Yang, think about balance. Yin is basically, in Chinese medicine, body fluids. And the reason I bring this up is because those who have heat patterns, generally, as a byproduct of heat, they experience dryness symptoms. So when patients experience dryness symptoms, dry mouth, dry cough, dry skin, dry throat, dry eyes, you can use Yin Tonics to help the dryness. So these hold moisture in the body. So certain grains like millet, barley, quinoa, certain legumes like again, soybeans, black beans, kidney beans, mung beans, certain greens, asparagus, seaweed, spirulina, chlorella, green algae, and seeds like sesame seeds, pumpkin seeds, sunflower seeds. You notice a lot of berries like strawberries have seeds, raspberries have seeds. You can eat watermelon seeds. I tend to emphasize seeds because they're easy too. You can take it with you. You can snack on these, and you can sprinkle it into your food. Probably the most common seed, or at least best studied seed, is flax seed. Some of you may have heard of flax seed. And flax seed is known for lignans, which also flax seeds contain omega-3 fatty acids. Omega-3 fatty acids are the anti-inflammatory fatty acids compared to the omega-6 fatty acids, which are pro-inflammatory, which is much more common in the standard American diet. But lignans, which flax seeds contain, may benefit the heart, possess anti-cancer properties, and it may benefit individuals with certain types of breast and prostate cancer. Flax also helps stabilize blood sugar levels. But the reason I bring up flaxseed is because seeds in Chinese medicine in general help promote bowel movements. In fact, they're given for that reason. So those who struggle with constipation, usually we recommend different seeds in their diet. And you probably think of chia seeds, for example, is a very common one to help promote bowel movements. Again, that's another way to eliminate and clear heat. So this is not a good recommendation for someone who's already maybe have loose stools or maybe have diarrhea. A flaxseed would not be a good recommendation as a way to clear heat. But for others, this is something to consider as a yin tonic. And then another category, the last category, is damp foods. And again, you may be thinking, what's damp foods? I never heard of foods described in that way, but simply damp foods is the texture, something thick, something sticky, something turbid, something rich, something creamy. So you think about that texture of the food, that characteristic of the food, and you think about maybe like dairy products, maybe like milk, cream, cheese, yogurt, right? Those are kind of often thick, sticky, rich. Sweets, refined sugars, high fructose corn syrup, pastries. So you think about adding sugar and water. That's really what soda is just sugar water. Sugar makes everything thicker, it makes it more damp. Fatty and greasy foods, right? So French fries, fried chicken, potato chips, these snack items, these finger foods, these tend to be more damp. And then the things we add to food. So if you think about, sort of butter on a baked potato, you think about cream and coffee, think about syrup on pancakes, you think about ranch dressing on your salad or artificial sweeteners in your iced tea. These are all things that add taste, but they also add dampness to the body. And so you can think about, well, how does that relate to inflammation? The way I tend to think of it is, for example, in heart disease, what I mean by that is dampness. If you think about those with diabetes or things or patients with high cholesterol, hyperlipidemia, that you may take a statin for, well, those are pro-inflammatory and put you at risk for heart disease. And the reason that is because heart disease means you have a clot in your artery that supplies your heart, for example, that doesn't get enough blood supply to your heart. Well, dampness, if you can imagine, if you actually looked at a patient who had high blood sugar or high cholesterol, and you took a sample of their blood is actually thick. It's actually thicker than someone who's not having hyperglycemia or hyperlipidemia. And that viscosity, that thickness of the blood is dampness in the blood. That dampness in the blood is more prone to clotting and forming inflammatory cells that then cause clots or inflammatory diseases. So what that means is dampness, when it gets stagnant, or again, stagnation, leads to heat. It generates heat, again, inflammation. So we want to minimize the dampness in the body by reducing these types of foods. So I talked really briefly about generating heat, clearing heat, reducing heat. What do we do in the clinic to treat heat? Well, we do things like acupuncture, teach patients acupressure points. There are specific points that are classically used to clear heat, help sleep, right? Help promote digestion in terms of constipation, help with relaxation, and so forth. We also do trigger point injections. Trigger points are tight muscle knots that can often form, as I mentioned. You can feel this under stress. You can feel your muscles start to tighten up, maybe your shoulder, your neck, or your back muscles. These form trigger points. We can release them with trigger point injections. I think of the neck and the shoulders when you have rising symptoms. It's like a pressure cooker, right? You have the pressure cooker generate so much heat, you need a release valve. If you don't get a release valve, the pressure cooker is going to, again, combust or just blow up. The body does the same thing. The release valve, often here in the shoulder and the neck area, we release the tension with trigger point injections or acupuncture or acupressure massage. As I mentioned, treating heat, Chinese nutrition, Chinese herbal medicine. We went into quite a bit of detail with that. The anti-inflammatory diet, restorative sleep. Again, we have to find ways to promote the quality of sleep. We have to manage stress, reduce stress when possible. Mind-body exercises, deep breathing exercises can be helpful. Appropriate medication reduction. Obviously, we may want to reduce the steroids, reduce the chemotherapy, do that whenever possible. When able, it's important to do. Just a couple more slides here. So in summary, self-care becomes so important. Self-care, you have to be your own first line of defense. And we at the clinic really try to set the foundation for specific recommendations that can help a patient better take care of themselves. Right? So what can we address? Well, we sort of touched upon, even in this talk, the importance of stress management, stress reduction, diet and nutrition, hydration, regular elimination, appropriate exercise, breaking a sweat, restorative sleep, turning the engine off, talk about quitting smoking, appropriate medication reduction. All of these have cumulative effects to clear heat, reduce the heat coming from the body, reducing inflammation. The thing is, this is all a pattern that we try to identify. If we don't identify and change the pattern, then we can't expect the result to change. And that's what this proverb I'm going to close with is saying. If we don't change our direction, we're likely to end up where we're headed. And that's what it is with chronic disease, chronic stress, chronic inflammation. And we have to make these changes, and it ultimately starts with our lifestyle. And perhaps for some of you, maybe consider starting with your diet. So I just want to leave you with that. There's the resources for those who are interested in learning more about Chinese nutrition. There is a book called Healing with Whole Foods by Paul Pitchford. It's actually quite thick, but you can get this on Amazon. You can get this at Barnes & Noble's. It's a good resource if you're interested in. And then there's our Center website, and our informative website. We do things to have regular updates on integrative medicine. So thank you. That's all I have for you in terms of my talk. I'm going to go ahead and stop sharing and open it up for any questions. Let me see here.
Thank you, Dr. Ta. As soon as you, I guess, are done sharing your screen, we'll jump into some questions. So we'll take some time to answer questions. As a reminder, if you haven't yet, the Q&A box at the bottom of your screen, you can type your questions there. So we will start with this question. Can Chinese nutrition interfere with Western medicine prescriptions for arthritis? The patient takes statins, glaucoma drugs, and meloxicam.
All right, so let me just say, so I see this here. So can Chinese nutrition interfere with Western medicine prescriptions for arthritis? For example, this patient takes statins, glaucoma drugs, and meloxicam.
Yeah.
Well, I would just say as a general statement, yes, not Chinese nutrition per se, Chinese herbs can for sure. Chinese nutrition for that reason is often what I tend to recommend because it's safer in that regard. Nutrition, dietary doses in general, I'm not too concerned with interactions with Western medications. That being said, I mean, those are things you have to think about. For example, when it comes to diet for Chinese nutrition, statins, I really don't have a specific concern other than the general concern, not so much interacting with the statin, but the purpose of the statin. Yes, we want to make sure we reduce cholesterol and fat content and so forth, but not a specific interaction of foods with statins. Glaucoma drugs, no, not so much. Meloxicam, that too can be a blood thinner. So with nutrition, I mean, ginger theoretically, turmeric theoretically can thin the blood, but it's not so much a dietary dose you're concerned, it's supplemental doses. So again, ginger capsules, vitamin E, fish oil, garlic capsules, those all can promote circulation and can therefore lead to bleeding. So those are ones I would be careful with if in a supplement dose. But from a nutritional perspective, I think you're pretty safe.
Question number 2, how can someone balance controlling heat if they are frequently prescribed steroids for arthritis or other illnesses?
It's a great question. And it's a common scenario we see in our clinic. What I would say is the pattern that's identified and the self-care lifestyle changes that can be made will hopefully decrease the amount of heat the patient generates and hopefully find alternative natural ways the body can clear the heat. If you can't find ways to clear the heat or decrease the net amount of heat in the patient, a patient won't be able to reduce their steroids. So we have to be effective in terms of partnering with patients to help reduce the heat in their system. Sometimes they unknowingly or unintentionally are able to reduce their heat. But if that doesn't happen, then we have to guide patients on how they can effectively reduce the heat in their system to allow them to wean off the steroids. If not, when they wean off the steroids, their symptoms will continue to break through. So I would say that we have to be very proactive about this. And that's why we have to do a heat intake in terms of heat in and heat out. And I think if we can get a net negative amount of heat, then over time, one can reduce their steroids.
Question number 3, if someone wanted to change their diet but felt very overwhelmed, what would you suggest their first step be? Eliminate a certain warming food or introduce a cooling food consistently?
Yeah, that's a great question too. In Chinese medicine, as a general rule of thumb, we use this sort of phrase, excess first and then address the deficiency. In this situation with heat patterns, usually heat is the excess. So what we tend to recommend is try to eliminate certain things that tend to be more warming. I think that tends to be a better way to go. That way you're not necessarily depriving yourself of something, you're continuing to have certain foods that you're used to having, but you're identifying maybe 1 or 2, and starting with that, foods that are warming that you can reduce or over time eliminate. That I think would be more effective, more sustainable, and I think hopefully more positive reinforcement to encourage you to continue to make other dietary changes. And that's probably the strategy I would use in general. But each person is different. As we do a dietary intake, we probably maybe something else would be more high yield, but in general, I try to take away the excess and try to eliminate more warming foods first.
Great. Question number 4. How does Chinese nutrition differ from other recommendations for arthritis, like the Mediterranean diet? Which would you say is best?
Yeah, another great question. So let me just start off by saying Mediterranean diet is usually characterized by a plant-based diet, lots of fruits and vegetables, legumes, seeds, maybe meat protein in the form of chicken, poultry, fish, trying to avoid red meats, trying to avoid processed foods, trying to avoid processed sugars, trying to minimize dairy. So what I'm saying, it's more certain parameters, right? Whereas Chinese medicine is more individualized. What I mean is not every arthritis patient is given the same thing. What I mean by, I said this in our last webinar, it's not the disease, it's the patient with the disease. So you can have 2 patients with rheumatoid arthritis and you can give different recommendations because it depends on the person. So what I mean by that is you can't study something like that. You can't study Chinese medicine in terms of how it's used real world and compare it with the diet like Mediterranean diet, because the Mediterranean diet is very much more standard in terms of you can study that because it's pretty consistent in what's being recommended. The Chinese medicine, on the other hand, Chinese nutrition it's not consistent enough where you can actually study it because the studies are trying to eliminate all the variables and trying to have something very fixed. But so that's one thing. But in terms of recommendations, the Mediterranean diet is actually very healthy. It's been shown in studies to help with heart disease, with cancer, with decreasing mortality. And I think it's also been shown to decrease inflammation. So I think it's a great diet when it comes to arthritis, for example. So I would be for that. But I would say that there would probably be some fine tuning. Mediterranean diet maybe as a foundation, and then fine tune it with some Chinese nutritional recommendations depending on the person with the arthritis. So that's the way I would probably answer that question.
Question number 5. My dietitian has warned me about completely cutting out dairy as it's a good source of calcium for me and inflammation reducing probiotics with yogurt. Can it have a healthy place in a diet for Chinese nutrition?
Warn me about completely cutting out dairy. So it is as is a good source of calcium. Right. So you have to find, if you eliminate dairy completely, you'd have to find other sources of calcium, which if needed can be done in a supplement form. And inflammation reducing probiotics with yogurt. So dairy in general for some people, and I should just say, each person again is different. As some people have recognize clearly that dairy affects their inflammation. Their joint pains get worse with dairy. And for others, they don't see a clear connection with it. I would just say in general, the recommendation is a good one. If we were looking at a certain food group to eliminate, often dairy is something we would consider first. But you can get probiotics in other forms too. So you can get probiotics, you don't have to necessarily get in yogurt, you can get that in a capsule form. So if your provider is recommending to not do probiotics because of yogurt, you can still get probiotics in other ways. Can it have a healthy place in a diet for Chinese nutrition? Meaning, can dairy have a healthy place? I would tend to say, again, each person is different, but as a general, even me personally, I tend to minimize or try to avoid, if I can, dairy in terms of in my diet. But it's not to say you can't have any. I just say it's an individualized situation, but clearly if it makes your symptoms worse, then yes, your body is not, dairy is not something that your body is ready to have.
What effects do salt and food dyes have in triggering heat and inflammation, as well as alcohol?
Yeah, so, well, things that are processed can create more symptoms. MSG, it's a classic example. It's often common in processed foods that can trigger inflammation. I think that's pretty well documented. And there's other food additives, including dyes and colorings, that can trigger inflammation too. I would say whenever possible, you're trying to make your own food, so you know exactly what goes into your food, and you don't have to worry so much about those synthetics or things that are processed. Alcohol too. Alcohol can increase symptoms. I know the Mediterranean diet recommends maybe some alcohol in moderation. I guess again, it's individualized. I would say alcohol in general is warming. I mentioned as a warming substance so as a general rule, alcohol is a slippery slope. I know they say it in moderation, but we don't want the message to be, oh yeah, go ahead and have alcohol. And what's moderation for one may not be moderation for another. I would just say in general, I tend to avoid alcohol as a recommendation. But if you want to have alcohol, have it on occasion, assuming it doesn't flare up your symptoms.
Is adrenal dysfunction similar to stress effects that you talked about earlier regarding allostatic load?
Yes. So as I mentioned, the hypothalamic pituitary adrenal axis in that definition. So the adrenal is one of the organ systems, is one of the glands that regulates the stress response. And so adrenal dysfunction is an example of a dysregulation of that cascade, of that physiologic cascade, when that stress response is thrown off or becomes haywire. So the answer is yes. And so I would just say this is important for those because many patients are on steroids. They can't stop steroids because their adrenals are used to not releasing its own steroids because they're taking exogenous or outside steroids into their system. Okay, it kind of shuts down their adrenals, causing some adrenal insufficiency. So how can one get off steroids? Because their body's so used to it. So a consideration is licorice root tea. Now, licorice root tea, it looks like it smells like black licorice, but it looks like a ginger root. You can get licorice root tea. And the reason I mention this is because licorice is a natural occurring steroid. And if you perhaps consider taking licorice, and then perhaps that will help you be able to reduce the steroids over time. Again, any recommendation I'm making, you should always consult your physician, but you can do licorice in a dietary form, specifically a tea. It also comes in a supplement form, but again, I tend to recommend teas so you avoid that potential interactions.
You talk about minimizing processed foods and dairy and soybeans. They're all listed as Yin Tonic. What about soy milk?
What about soy milk? Yeah, so I think the unfortunate thing is a lot of our soy in this country in many ways is processed. So, and assuming that you're not concerned about a family history or personal history about estrogen receptor positive breast cancers or endometrial cancers, then I think soy is reasonable to do. Soy milk, you'll notice, is not as thick as say cow's milk, so it's not damp, thick. And just like other forms like rice milk or almond milk, they're much thinner than dairy. So I think soy milk is reasonable as long as you don't have that personal family history and as long as you don't have a specific allergy or reaction to soy. But if you were to take it, you would try to get it in its organic whole form. So I tend to recommend edamame soybeans. And then that way you don't have to worry so much about the processing, which can occur like with soy milk or with tofu and things like that.
How can you find a credentialed professional to someone that practices Chinese medicine?
Yeah, another great question. I think acupuncturists are licensed by their state. So depending on the state you're in, for example, if you're in California, it's the California Acupuncture Board. You can go there, you can search by your zip code, and you can find a practitioner who has an active license. And then from there, you can probably find the name and search them online. And you're kind of based upon, reviews from others or maybe a personal recommendation from a friend or family member. But it just makes sure someone has their active, a license that's active in good standing. You want to check the state board. And then that would assume then that they're licensed, that they have the proper training and education from an accredited institution. Beyond that, then you'll probably want to call them on the phone or somehow reach out to them to see because communication is an issue, right? Communication in terms of can be an issue in terms of being able to not only speak conversantly, but be able to explain things in a way that's understandable. Because you may go to an acupuncturist, you have no idea what they're doing with their needles and what they're doing with their herbs, right? So ideally, you're finding someone who can help explain and maybe articulate their thought process behind that. So I'll start with the acupuncture board, and then beyond that, try to look at reviews, and then maybe reach out to them. If you can get them on the phone, you get a sense of how well they can explain things to you. So hopefully give you a certain level of comfort.
Can Chinese herbs be taken in supplement form, which I think we talked a bit about? How do I know which are the best kinds of supplements to buy, and when can they be harmful?
So just to answer the first question, Chinese herbs when taken in supplement forms, yes. I would say though it's really not the way it was intended. For example, like bitter melon, that's a common Chinese herb. But supplements are purified and are more potent, right? So it's one ingredient formed into an extract that you're taking a large amount at one time. So it goes against Chinese medicine principles in the sense that Chinese medicine is more done in smaller doses with a combination as an herbal formula. It's in the context of a formula. It's not given as an individual thing. So, so to answer your question, Chinese herbs technically aren't given in supplements because they're not given as formulas. But you can take individual herbs and put it in supplemental doses, like bitter melon, like ginger, like turmeric, like garlic, and you can take it in that way, just with those cautions. Again, we don't know about herb-drug interactions, where you have to be more concerned about if you're taking something in a supplemental dose. How do I know which are the best kinds of supplements to buy? That's another good question. I mean, supplements aren't regulated by the FDA. So you're hoping to find something like a USP, which is like a third-party independent body that tends to test these to make sure it's good manufacturing practice, that is actually quality controlled, and it has what it says it has. So you're looking for brands that have this independent CLA, GMP, good manufacturing practice, or USP, that would indicate that it's an independent party that's validating the quality of the product. Can they ever be harmful? Yes. I hope I answered that question. They can be harmful. So any supplement, just like a medication, you should let your provider know before starting, and you should have it listed. And I think I treat supplements the same way as medications, in the sense that it should only be given for a certain indication. If that indication is no longer there, then I would recommend stopping it. So in other words, I wouldn't be saying everyone should be taking multivitamins. Everyone should be taking vitamin B complex. Everyone should be taking magnesium or fish oil. It depends on the indication. If that indication is there, then it's reasonable to do. But definitely let your provider know whenever you're going to start any type of supplement.
What is better? Raw versus cooked, fresh versus frozen, organic versus non-organic?
Yeah, I would say in general, organic is better. Now, certainly it's more expensive, so you have to balance that with one's finances. So that's more of a personal decision. I think the Environmental Working Group, if you Google them, they have a website. They talk about, I think, the dirty dozen. Those are the 12 that you try to avoid, that you try to get, have an organic form, would be better off. If it's fruit and vegetables, they tend to be pesticides and things that are stuck to the surface or the outside. So if you can take something and peel it, that can help circumvent some of the concerns about having something non-organic. In terms of raw versus cooked, it depends on the individual. I would say I tend to be careful with raw. The reason I say that is because raw foods, for all of us, have to be warmed up and cooked by our stomachs in order to digest it. Meaning our bodies, we're at 98 degrees. So if you put something raw, something uncooked, it's going to take much more energy by your stomach to process. And so if you have raw foods, what you may notice is you may feel more tired. If you're already having fatigue, if you're already having feeling like weakness, you have a low constitution, you have to be careful with raw foods, because that can make the underlying situation worse. You can make you feel more fatigued, have more indigestion, more bloating, more gas. So if you're having indigestion, you want to have warm and cooked foods, because it's going to help your stomach out to make your digestion more efficient. So in general, I tend to avoid raw foods. Doesn't mean you can't have raw foods, but for those with those type of symptoms, I would be careful with raw foods. Fresh versus frozen. Fresh is always ideal. Sometimes not practical, so you can still get by with frozen. Especially, like I mentioned, in the summertime, there's certain fruits, certain vegetables, certain berries, for example. You can't get it in the wintertime. You can freeze it, and then you can then use it, according to your serving size at your convenience during, say, the winter when you can't get it. I think that's totally reasonable to do.
All right. And our last question, which spices are better for a sensitive GI tract or a sensitive stomach?
I think it's more, again, of an individual situation based upon their situation. For example, ginger for some people, for many people, settles their stomach. For some people, it gives them heartburn. So that's a hard question to answer. Again, it's an individualized situation. But the thing about diet, unlike capsules and supplements, it's easy to try a diet, And if it causes symptoms, let's say ginger tea upsets your stomach, you can easily stop it. Same is true with mint, right? With any of these things, you can easily stop it and not worry about harmful side effects. I would just say it's an individual situation. You can try it in a dietary form. If it doesn't work out for you, it causes a reaction. It's an indication it's something that your body should be taking. Your body will never lie to you. So don't listen to me. Don't necessarily listen to your doctor in that regard. Listen to your body. And then beyond that, then you follow the guidance of your health provider.
Great. Thank you, Dr. Ta, for sharing your time and your expertise with us tonight. I think that I can speak on behalf of everybody and say that we all learned something tonight, and definitely gained a different perspective on how to manage our arthritis symptoms and our inflammation through diet. So thank you so much.